To the public advice on coronavirus disease, COVID-19, section navigation coronavirus prevention, COVID-19, be sure to stay updated on the COVID-19 outbreak, on the World Health Organization website and through local and national public health authorities. While COVID-19 infection is still mainly in China, there are some hotspots in other countries. Most individuals who develop the infection feel mild symptoms and recover, but the symptoms may appear more severe in others. Take care of your health and protect others with the following measures. Wash hands regularly. Why? Cleaning your hands with soap and water or rubbing them with an alcohol disinfectant will kill the viruses that may be on your hands. Ensure respiratory hygiene practices. Make sure to cover the mouth and nose by bending the elbow or a tissue with coughing or sneezing, then dispose of the tissue immediately by throwing it in a closed waste bin and clean your hands with an alcohol cleanser or with soap and water. Why? Covering your mouth and nose when coughing and sneezing prevents germs and viruses from spreading. If you cover your mouth and nose with your hand while sneezing and coughing, germs may be transferred to all things and people you touch. Avoid getting too close to people. Keep at least 1 meter, 3 feet, between you and anyone coughing or sneezing. Why? When a person coughs or sneezes, small liquid droplets may contain from their nose or mouth that may contain the virus. If you are very close to it, you can breathe these droplets, including the virus that causes COVID-19, if the person has it. Avoid touching your eyes, nose and mouth. Why? Hands touch many surfaces and can catch viruses. If the hands are contaminated, they may transfer the virus to the eyes, nose, or mouth. The virus can enter the body through these outlets and make you sick. If you have a fever, cough, and trouble breathing, seek medical advice right away. You may have a respiratory infection or other severe illness. Call before going to the caregiver and tell them if you have traveled or been in contact with any travelers recently. Why? Your pre-contact with your care provider will allow you to direct you quickly to the appropriate health care facility. This will also help prevent any possible spread of the COVID-19 virus and other viruses. Follow the developments and follow the advice of health care providers. Be sure to follow the latest developments regarding COVID-19 disease. Follow the advice provided by your health care provider and that issued by local and national public health authorities or your employer on methods to protect yourself and others from infection with COVID-19. Why? Because local and national authorities have the latest information on whether COVID-19 infection has already spread in your area, they are best able to give advice on what people in your area should do to protect themselves. Protection measures for people who have been in or recently visited COVID-19 infection within the last 14 days. Follow the instructions above. If you start to feel unwell, even with mild symptoms such as headache, low-grade fever, 37.3 degrees Celsius or more, and a slight runny nose, isolate yourself by staying at home until you recover completely. And if it takes the help of someone to bring the supplies you need, or if you have to go out to buy what you eat, for example, wear a mask to avoid transmitting the infection to other people. Why? Avoiding contact with others and visiting medical facilities will allow these facilities to function more effectively, and will help protect you and others from the virus that causes COVID-19 and other viruses. If you have a fever, cough, and difficulty breathing, seek medical advice right away. You may have a respiratory infection or other severe illness. Call before going to the caregiver and tell them if you have traveled or been in contact with any travelers recently. Why? Your pre-contact with your care provider will allow you to direct you quickly to the appropriate health care facility. This will also help prevent any possible spread of the COVID-19 virus and other viruses. Ask who question: should I avoid shaking hands due to the emerging coronavirus? Answer: yes, because respiratory viruses can be transmitted by shaking hands and by touching the eyes, nose and mouth. Greeting by waving remotely, gesture, or bowing instead of shaking hands. Question: how can I greet a person in order to avoid being infected with the emerging coronavirus? Answer: to avoid COVID-19 disease, it is safer to avoid direct contact when greeting. The safe greeting includes waving, gesture and bowing. Question: is wearing rubber gloves in public places effective in preventing infection with the emerging coronavirus? Answer: no. Keeping bare hands washed ensures that you are better protected from COVID-19 infection than rubber gloves will guarantee. as the virus can be infected through the gloves themselves. If you touch your face, the virus can spread from gloves to your face and make you infected.